5 main types of cancer affect a woman's reproductive organs, are cervical, ovarian, uterine, vaginal, and vulvar. Each gynecologic cancer is unique, with different signs and symptoms, different prevention, treatment, and prognosis. Any woman is at risk for gynecologic cancers, and risk increases with age. Uterine cancer is the most common gynecological cancer. Risk factors for uterine cancer: obesity, diabetes, hypertension, and use of estrogen without progesterone. Risk increases with age. Signs and symptoms: vaginal bleeding between periods, or vaginal bleeding or spotting after menopause. Lower abdominal pain, lasting more than 2 weeks. Endometrial cancer is the majority cases of uterine cancer and is also one of the most curable one. Endometrial cancer is diagnosed quite early in most cases, and hence is treated by a laparoscopic, minimally invasive, surgery. 2. Cervical cancer. Cervical cancer is also common gynecologic cancer and it is one of the leading causes of cancer-related death in women worldwide. Cervical cancer is associated with human papillomavirus infection. Cancer develops slowly and before cancer, there is cervical dysplasia, which can be screened. So screening is part of prevention of cervical cancer. Symptoms and signs: vaginal discharge, vaginal odor, bleeding after sexual intercourse, abnormal vaginal bleeding. If diagnosed early, cervical cancer can be treated by radical surgery alone, while those detected in advanced stages require a combination of chemo and radiation therapy. Vaccinating young girls for preventing HPV infection before they are sexually active is a very effective way to prevent cervical cancers as well as many other forms of gynecological cancers. 3. Ovarian cancer. Ovarian cancer is another common gynecological cancer. Signs and symptoms: extreme and sudden onset of bloating, difficulty in eating or loss of appetite, unexplained weight loss, increased frequency or urgency of urination, pain and discomfort in the pelvic or abdominal region. Ovarian cancer exists different forms. Epithelial ovarian cancer, which can be more aggressive, and germ cell tumor, which usually seen in younger individuals but highly curable. The third type of ovarian cancer, i.e. the stromal cell cancer, is usually slow-growing in nature. A majority of such cases are treatable by surgery alone. Vulvar and vaginal cancer are rare. Signs and symptoms include abnormal vaginal bleeding, pain during and after intercourse, itching, burning, pain, or tenderness of the vulva, and changes in vulvar color or skin, such as a rash, sores, or warts, are found only in vulvar cancer.